Hi, I'm Teresa and this is Chris. We're licensed massage therapists and we're here to start the trainings with you on how you can use your beautiful crystal therapy massage tool on yourself for self-care. So the first video that we're going to focus on is going to be in the shoulders and in the arms and in the front part of the chest. With everyone on their computers right now and on our phones and on technology, those are areas that can cause some problems. So I'm going to turn it over to Chris and he's going to show us how we can use the crystal therapy on those areas.
Perfect. So when you're sitting, your shoulders are going to start internally rotating. So opening that up is going to really start making you feel a little bit better. So with that being said, we're going to just turn it on as you saw in the introduction video. And we're just going to start working in that chest pec area. Nice and slow. Slower is better. It really lets the energy sink in and really is the most beneficial way to do that. You can take as much time as you want. I'm not going to spend a whole lot of time since this is a training video. So after you're working on pec, I'll take it straight out to the deltoid.
And this would probably be really good for people that work out too, right, Chris?
Oh, absolutely.
Yeah.
You want to make sure you're hitting all of the deltoid, not just staying on the front side or in the middle or in the back. Making sure you're hitting all of that muscle. Then from the deltoid, we're going to take it straight down into the biceps or your upper arm. And those muscles, there's going to be two muscles in there, so make sure you're hitting both of them. You got one on the outside here, as well as on the inside. Just nice long strokes, nice and slow. After a couple passes there, we're going to slide straight down on the forearm. And once again, make sure you're taking it nice and slow. It's really going to feel good.
That could be very beneficial, do you think, with people with tennis elbow?
Tennis elbow,
Golf elbow.
People are golfing, pickleball for all you pickleballers out there. So when you start coming down into the forearm, closer to the hand, be a little careful. You're going to start hitting some bone. You really want to stay away from bone. Any kind of bony areas, bony landmarks, it just doesn't feel good. So make sure you're staying right in the middle on the forearm. Then from here, we can actually come straight across into the other side of the forearm on that inner side. Nice and slow. And then straight down into the hands. So you're going to be hitting it right in that meaty area, right where that thumb is. This is really going to be able to open up those hands and relax those hands, driving in that healing energy. Then on the outside. And my absolute favorite, you can use this with any of the attachments. You're going to bring the thumb down here and hit right on that inside, right in that webbing.
And that's a master acupuncture point in there too.
That is correct.
I can feel the energy all the way up into my face right now.
Yep.
Yeah,
It's going to be
it's
troubling.
amazing.
Especially through the hands and the arms, that is a huge pathway for energy travel. So that is arms and pec. We can also go up into a little bit of trap, which is going to be your upper shoulder right in here. Just be aware of the bones again, because you're going to hit it, it's not going to feel good. And we want to feel good.
And depending on your flexibility and what feels good to you, you can either use the same arm if you need to, or cross over, whatever feels good.
So that is upper body. We will continue with more videos later.
Make sure you do the other side so it doesn't feel cheated.
Absolutely.
All right. Thanks, Chris.
Thank you.
Hi, in this video we're going to focus more on the neck area and up into the base of the skull, very beneficial for tension, potentially for your helping with your headaches, support headaches. So before we start with this one, switch over, and all you have to do is pull them off. Switch over to your soft touch attachment, because you want to have the little bit softer touch attachment for this and not the big ball. So I'm going to turn it over to Chris so he can show you what areas to work in.
Hello again, everybody. Back doing another training video. So we're going to be working on neck. You always want to start right with that big bone at C7. You can feel it, you see it. So we're going to start right there, and we're going to be working right along that side of the neck there, going up into the base of the skull. You don't want to go on the skull. We're not going to get into that stuff right now. So working right up into occiput is really going to help with those headaches and promote that release that we're looking for, especially looking at computer screens and all that kind of stuff. Really working up in that area. And once again, make sure you're staying away from any kind of bones. You want to stay away from the center here, all the cervical spine. And you also don't want to go too far to this side. There are a bunch of nerves in there, and you really don't want to damage those. So be very careful. Make sure you're not using too much pressure either. Really listen to your body. If it feels good, then you're doing a good thing. So happy working, and hopefully that helps you all.
If you've had any surgeries or any injuries in that area, make sure you check with your healthcare professional if you have any questions or concerns in that area. Thank you. Hi, in this video, we're going to start to address the upper hip and the front of the leg and side of the leg area. This area can be involved in low back pain sometimes, but a lot of times we're just very tight in that area. And this also is the start of starting to ground ourselves to that earth energy by using the crystal therapy. So I'm going to turn it over to Chris to show you ways we can work on ourselves. He's going to do it in a chair, and I'm going to do it from a standing position.
Hello again, everybody. Here's another training video. So we're going to start getting into that upper leg and that quad area, as well as the hip flexor. It's called TFL, tensor fascia lata, but it's going to be right up at the top here. And you can really feel that if you actually rotate your foot, your entire leg with your foot going medially. You can really feel how that muscle engages, and that's where we're going to really be focusing, and then starting to get into the quad as well as the IT band. The IT band is also going to be playing a huge part on some of that knee pain, so we're going to really start supporting that recovery process. So with that being said, we're going to start right up here at the top of the TFL, or the top of the leg at the TFL, and working nice and slow.
And Chris is demonstrating with the actual ball attachment. I'm using the soft touch attachment. So either one, whatever feels best to you. TFL can be very sensitive on a lot of people, so make sure you listen to your body.
Absolutely. Always listen to your body. I mean, it's so important to start being in touch with how you feel and what things feel like, and being in tune with your muscles, and that's really going to help with that energy healing as well. So now we're going to start coming down right along this side there. We're not going to quite hit the IT band. When you start getting closer to the knee, be careful. Once again, you're going to be getting close to those the bones and that kind of thing. So you want to really stop about that far up from the kneecap. You don't want to go much closer than that because you're going to start hitting that bone. Then we can come right down the center, which is going to be great. And also a good tip is if you're worried about hitting the kneecap, you can actually put your hand over the kneecap. So you're going to cup it with your hand, and you can go right up to the fingers. It may feel a little weird if you hit it, but it's not going to do anything too significant to where it's going to hurt or anything like that. And then we're going to start right in the middle of the quad, and we're going to come down towards the middle of the knee. So it's going to be kind of like a diagonal line straight down. Once again, if you want to have your hand on the knee, just to make sure you're not getting too close to that kneecap. That is perfectly fine. So we're just going to work through that. After you're done with that, we're going to come into the IT band. Whenever you're doing IT work, especially with guns, the massage guns, rollers or anything like that, you don't want to go directly on the IT band. You can damage it, and that's not a good thing. So when you're working on that, you can actually feel the muscle wrapping around to the IT band. So that is the line where it wraps in, where you feel that muscle. And you're going to go straight down just like that. And you can put the hand again on the knee just to make sure that you're not hitting the kneecap.
So this may be beneficial also, Chris, for people who have some knee issues, depending on what that issue is, all those attachments of the muscles that come above and below your knee. So loosening up and bringing that beautiful earth energy into the quad area. Plus a lot of our lymphatic system runs through our thighs. Caitlin talks about that, and one of the reasons why we don't want to put our laptops on our thighs. So get that good energy going through those thighs, and yeah.
Absolutely, and for runners and athletes who are doing powerlifting, this is also going to be a great thing for you guys. Any kind of squats and that kind of thing, it's really going to help promote that healing energy for you.
All right, thank you.
Thanks again.
Hi, in this video we're going to address the lower part of the leg. Very beneficial area to work on if you have problems with plantar fasciitis or ankle issues. So I'm going to turn it over to Chris so he can show us beneficial ways to work in that area.
Hello again, everybody. Here we're at another training video. We're going to be hitting the peroneals, which is the shin muscles right through here, as well as the calf muscles. This is really going to help with the grounding as well, grounding your energy and that kind of thing. So when we're working, you can put it to the level that you feel most comfortable with. Once again, be careful of the shin bone. You can always use your finger for a marker so you're not hitting that bone. And we're going to be right up against the shin bone without hitting it, and working straight down all the way through. Also be careful of that lower knee area. There are bony landmarks there as well, so you don't want to go too high. Once again, you can cup your knee with your hand to give you a marker, so you're making sure that you're not hitting that knee. So you're going to go straight down, close to the shin, and then come a little bit more to the side or laterally, and work straight down that direction as well. And then right along the side of the leg. It's going to feel really good at the bottom. Be careful of the ankle bone and also the knee, like I said before. You can feel that bone right in this area, so just be aware of that.
And Chris is using the round attachment, and I'm using the soft attachment. So either one is great depending on your level of comfort and what feels good to you.
With that being said, we're going to go straight into the calf area. Again, I'm going to emphasize staying away from the bones. It just doesn't feel good. But with this, you actually can hit the Achilles tendon. It's really going to help with the promotion of healing through the plantar fasciitis, people who have that going on. So working all the way through. And remember to try to relax that muscle, not to have it flexed when you're doing these self-care things. So there is that training video. Happy healing, and we'll see you soon.
Thanks, Chris. Hi, in this video we're going to address low back, hip, down the back of the legs. A lot of people have low back discomfort and hip pain. So we're going to show you some ways you can work with the crystal therapy in those areas that can be beneficial.
Hello again, everybody. Back for another training video. So when you're working on lower back, it's going to be a little tricky, so do what feels comfortable. Don't torque your body and make things seize up and then you have more issues. So make sure you're doing things that is comfortable for you. So when we're working, we're going to be hitting the lower back. So we're going to look at the lower erectors into QL, the lower back muscles. So when you're working, we're going to hit straight up and down in this direction here. So as you reach through, you can hold it as Teresa is here, or I find that sometimes when you are working on lower back, you can actually bring the gun in through this way as well, whatever is most comfortable for you. So for Teresa, obviously this direction is a little bit more comfortable. So we're going to be working straight up and down. Once again, be careful of the spine and the bones. We've talked tons about that, about staying away from that because it hurts and doesn't feel good. So we're going to be working up and down, and then we're going to come actually down right above the pelvis and straight across to the outside of the body. Working through QL, a little bit of glute as well. And from this position, I like to come straight down on the side of the glute here. So we're going to come straight down. Be careful of that hip bone. You can actually kind of rotate around that hip bone and stay close to it, so you're really penetrating with the energy and getting in there and getting a good release. After here, we are actually going to start getting into the glute med and max and really start getting into some of the piriformis muscles, which is one of those muscles that contributes to that lower back pain, as well as sciatic issues, if that is something that you are experiencing as well. So we're just going to work straight across the lower back here. Nice and slow again. When you get into the piriformis muscle, if you are experiencing those sciatic symptoms, you can actually feel like there's a little notch right in the middle of the glute. If you feel that, that is exactly where that piriformis muscle, and you can actually just stick the crystal therapy straight in there and just hold it. You can move it a little bit, but really focus in there, and it will help. After you get through that, then you can start coming down the back of the leg into the hamstrings. The hamstrings also contribute to lower back issues as well, and helping promote that release and really finding some relief that you were looking for. So while you're working through the hamstring, you can hit that IT line as well, just like we talked about on the quad side. You're going to feel that muscle kind of wrap around into the side of your leg. That's that line that you want to hit. So it's about a 45-degree angle, if you will. That's that line for the IT, and then you can come straight down in the middle of the hamstring, as well as coming in a little bit more on that medial side, closer to the center of the body. Once again, working slow is the best way to go. Listen to your body. If it feels good, you're doing good work.
You want to make sure you stay out of right directly behind the knee in that area. There's a lot of nerves that go through there, and you want to stay off of that. That's a contraindication, so stay out of the back of the knee.
That is true, very true. We don't want to be messing things up and causing more pain than healing. So once again, happy healing and enjoy your crystal therapy.
Enjoy the energy. Hi, in this video we would like to address you working on another person, because I know you're going to want to share this with your loved ones and friends, and it's a little hard to work on our full spine ourselves. So I'm just going to demonstrate a little way that you can work on one of your friends or coworkers or loved ones by having them sit in a chair. Because obviously not everyone's going to have a massage chair or a table. You could lay someone down on a bed or a couch if you want to work on them that way too. So I'm just having Chris sit sideways on a regular chair just to give you some ideas how you can use crystal therapy. So really make sure you communicate with the person that you're working on to make sure you know how they're feeling, because you're not going to feel what they're feeling in their body. So, you know, take care with tension, not pressing in too much, starting out at the lowest setting and just seeing how that feels to them first. So I'm just going to start out putting it on just the lowest setting. I'm just going to start out up in this upper back area here, staying off of any bony protrusions. So use your hand to find where those bony protrusions are and just stay right in those muscles. So it feels really, really great up in the upper shoulders. So you can work in there for them. You can either just sit there for a little bit and let it vibrate, or you can move out a little bit, again, not going out too far on the shoulder itself. And another area that most all of us hold tension in would be right here in this upper back. So you can just take your time. You don't have to go fast. And you can put your hands on the spine. Just take your fingers and feel where their spine is. Stay off of the spine. You don't want to be on the spine itself. So just working down in those muscles. Feels amazing through here. People who hold tension in here, they're going to really like this. And you can go a little bit out on that shoulder blade area too. Feels really good out there too. And just again, communicate with whoever you're working on to make sure that they feel good. It feels good to them. You can also put just a little bit of pressure in. Chris gave us thumbs up, so that's a good deal. Then you can just keep working down the spine. Again, feel right where it's at, right next to the spine, not on it, but right next to it. Just staying on those spinal muscles that get tight. Now we're down into the low back area. And you can do this directly on the skin too. Working out on those upper glute areas and the hips, another area that we can carry a lot of tension. And then you can get right down into the glute area too. Might be hard if they're sitting on a chair, but you can always do that with someone standing up too. The other area you can work down is right down the sides of the legs. Again, just keeping it light. So that just gives you some ideas of how you can work on a loved one, making sure that, again, you're staying right off of that, being on the spine directly, just staying on the muscle area themselves, and make sure you work both sides of the body so something doesn't feel cheated. Anyway, happy vibes!